enjoy in private practice?
The shifts that we have at Wexford is 4 10-hour shifts at this facility.
At the hospital, I used to do 12-hour shifts, 7 to 7. Here I do either 5:30 to 4 or 6:30 to 5.
It's nice because I have a child, so I'm home every evening with him when he gets home from school.
Well, I think the differences between working in corrections as opposed to working in a general clinic setting is that there is always a understanding that security is a top priority in the corrections. And so we have to add another layer of protection to the population on top of giving good medical care too.
One of the biggest challenges while working in a correctional facility is that you always have to think of safety first. The difference in working in corrections, corrections is a specialty nursing, and it involves a lot of safety and security issues where you might not think that you need to deal with in a regular facility. I have always felt very safe in the correction setting that I work in. There's always been an officer around, and I feel very safe and secure. Things have to be safe and secure before you can do any type of nursing.
Here at this facility, I feel very safe. There's always a guard with us. The inmates are usually very respectful of us. Whereas working in the hospital, I've been hit by a cane, just things like that, and you always worry if someone might pop off the elevator and might have a weapon on them. At the hospital facility, you never know.
I think that safety is a consideration, obviously, but it certainly is no greater a challenge to me now than when I was in the general community. I think that safety is actually less of a concern for me because there are corrections officers and security and cameras, which I did not have access to in the general community.
In a clinical setting, you could be in a room with a patient and they just grab you. Who's going to hear you? Here, there's always an officer with their eyes on you at all times, or the other nurses are real close.
I feel safety in corrections is the utmost importance as opposed to other facilities. If you would work in a regular hospital, you wouldn't have to worry about going in and performing CPR or stopping somebody from bleeding. As opposed to a correctional facility, you actually have to stop and think about why they are bleeding. You know, are they really unresponsive or are they faking it? And you have to stop and make sure that the area is secure before you go on to help them as a nurse.
I believe they still get the same care they get in the hospital situation.
In our particular facility in Dixon, Illinois, we certainly have X-ray 5 days a week. We have lab 7 days a week, and we can do our own EKGs. I do my own biopsies. I have staff that are equipped to provide me with surgical equipment, and I'm able to do minor surgeries, lacerations, and repairs.
We have the ability to do labs. We have a dental hygienist. We have a dentist full-time. We have a physician full-time that's on call 24 hours a day. He works 40 hours a week. We have optometry.
We have telemedicine consultation through the Wexford Health Source. And I have specialists in liver disease and kidney disease and psychiatry that I did not have in my own private practice that I can access through video conferencing and telephone calls with one step.
They know on the streets that they wouldn't be getting the care that they are getting in here.
As a nurse, we have the ability here to educate the inmates. We have several programs, especially our diabetic program, that we submit education to the inmates once a month to help them improve their care.
I absolutely feel like one of my chief roles is to educate the inmates about what is going on in their health and how we are making steps to improve them. And so education is at least 50% of my time within an individual inmate connection.
I see a lot of people, a lot of inmates that have like high blood pressures and high cholesterol levels, and we have to educate them how to bring those down, not only with the medication but by their diet and exercising. But we have a lot of people with those kinds of problems here. Some of the inmates listen to me, some of them they don't, and I tell them, you need to listen to me. I'm telling you this, it's important, and if you follow these guidelines, you'll be healthier, you know. And a lot of them do listen to me, but there are some that they don't, and they still come up complaining about the same things. I said, you weren't listening to me.
They try to do a lot of education with them, and most of them I do feel listen and pay attention.
And I mean, we've come a long way, we really have, and they do listen to us better now than they did when I first started. And I always make it a point to tell them, we're doing this so this doesn't happen.
I believe in my role as a healthcare administrator and medical director in a prison, I'm using all of the administrative and medical skills that I was gifted with. I have a gentleman who's got a bleeding disorder, and it manifests itself as a nosebleed, and he needs to have a chemotherapy agent to prevent the nosebleeds. That's not something you find very commonly in the general community. A second case is a gentleman with a rare bone tumor, and we found it very much by accident while he was getting a gallbladder operation. And as it turns out, the gallbladder trouble is actually going to save his life.
I've accomplished a lot. I mean, just like with any job, it does get frustrating. You feel like you could have done more, but I still feel like I get a lot done every day.
90% of them, yes, I do believe that they care or appreciate what we do for them.
I believe that the inmates in our population are very appreciative of what we do for them. Because we have a comprehensive health plan, they appreciate the fact that we are giving them individualized care, and in most cases they never received that before in their lives.
It's challenging, very challenging, and I love it. I love working corrections. I can't see me ever going back to the hospital after being here.